Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a 14-year-old child who attended with a really itchy ear, and this is their right ear. They attend more or less every 12 months to have their ears cleared. Now, they do suffer from psoriasis, and a consequence of that is a buildup of really dry, crusted skin in their ear canal. And I'm just using, in the first instance, microsuction to try and remove some of this debris. This skin plug is quite near the entrance, and with dead skin, it's quite reflective. It's got a protein called keratin, and keratin has the unique property of being hydrophobic, so it helps to repel water from the ear. It also helps to reflect away harmful UV rays from the sun. And that's due to the protein keratin that's contained within the skin cells. So it has a very important function and properties. However, because of its reflective nature, when you're performing earwax removal, it can reflect the light that we're illuminating within the ear back towards us. So it can make things a bit bright at times. We can adjust that actually using the iClearScope. We can adjust the exposure, so the brightness level, but it wasn't causing me too much of an issue. But I just thought I'll explain why it's quite reflective. So because we're close to the skin, because it's near the entrance, but also because of the reflective properties of dead skin and the protein keratin that's contained within skin. So you can see I've removed that plug of dead keratin quite easily, less than a couple of minutes. But this patient's got a layer of skin that's lining the ear canal. Now, with a child age 14, it can be difficult to perform a skin peel because they're not always the stillest of patients, naturally of that age. But this patient's been brilliant. It's been coming for many years now, and they're very, very still. The only other slight issue when performing a skin peel in a child is that the entrance of the ear canal typically is quite narrower than adults, and because you're working delicately on the bony part of the ear canal, you just need to make sure you've got enough working space within the ear canal because otherwise you can quite easily bump into the side of the ear canal walls and graze it, and we don't want that because that'll be uncomfortable for the patient. So I'm just using the endoscope to stretch the ear canal open. So this is their right ear, so the endoscope goes into the ear, and if you think about the entrance of the ear canal being like a clock, the endoscope will be positioned around 7 o'clock, so the bottom left, so you could even say southwest of the entrance of the ear canal, just past the first bend, and then we push the endoscope to the left. And what that does, it stretches open the ear canal and it straightens it. And by doing that, I can then insert the instrument into the ear. So you can see I've stretched the ear open, pushing it to the left, and I can go into the ear with the sucker seal. This time I didn't stretch it as much because I'm working on the front part of the ear canal. Sorry if I'm boring some of you guys. The reason why I'm explaining the technique is do get a lot of specialists who watch the videos online or people who previously trained or people who are interested in training, and do get quite a lot of emails saying thank you, and they enjoy all the technical side of it because it helps them with their technique. So hence why I'm just discussing in the first instance why it reflects the reflection of dead skin, and also the technique we use to perform endoscopic earwax removal. I've just instilled some olive oil drops, not too much. I just wanted to soften some of the skin because it is quite a thick adhesive layer, and the olive oil spray helps to just soften the skin and helps me to detach it and peel it away a bit from the canal wall. Now, whenever we're removing skin from the ear canal, we have to be aware of clarinetting. So clarinetting is when you suction dead skin, the skin at the tip of the sucker, it violently flaps, and that violent flapping of dead skin emits a very loud, high frequency squeal, and it's not only loud for the patient, but it's also loud for myself performing the procedure. So you can just, if you have that in comparison, if I'm finding it loud and I'm not in the ear, well, my ears are not in the patient's ear, should I say, I am in the ear with the instruments, it gives you an idea of how loud it can be for the patient. So we've got to be really careful, and using a fine end really, really helps. It reduces the suction power. Although it's reduced suction power, there's more. Sometimes you can get more suction because the smaller surface area. So as you know, with smaller the surface area, greater the pressure. So although the sucker is smaller and it's quieter, in some instances it can be a bit more powerful because it's the smaller surface area, and because the suction's concentrated on just a small part of the dead skin, which can sometimes have a greater net effect. So I'm just at the bottom here, just peeling this away. So there's still quite a lot of dead skin to peel. You'd be surprised how much we actually peel away. So do continue watching if you enjoy your skin peels. You can see the oil's done its job here. It's just really softened this. I'm just peeling this away. Some of the skin teared off, so just going to pick the skin back up. And then as I'm suctioning, I'm going up and away. You can see it's just loosening itself on the bottom, and I'm rocking it left to right, and that again helps to tear some of the skin. And the patient was brilliant. We're always checking on the patient to make sure they're okay, and they're actually quite enjoying the procedure because, as I said, the patient's got this itchy ear because of this skin layer. So me just trying to remove the skin for them, it gives them great relief. And a lot of patients with itchy ears, naturally they tend to poke and prod inside because to relieve the itch. This patient's no different. But because we're so deep, the patient can't reach these areas. So when I'm in there with the sucker and removing it, they do often comment that it feels good for them, and there's a lot of relief at the end. So we've got all the dead skin away from the lateral part of the ear canal, so near towards the entrance. Now we're just working deeper towards the eardrum. And you can see this technique I'm using. I'm just slowly but surely just trying to loosen it. And again, just going to you just want to find a weak spot sometimes with the skin. And obviously we're approaching the eardrum now. I'm just peeling downwards. So I've just come out. I'm going to go back with a different line of attack. There's just some debris at the entrance, so I'll just remove that first. So this skin, it's lining the northern hemisphere. It's from here, but it's lining the bottom here, but also the roof of the ear canal. So in a moment, you'll see me peel away a lot of dead skin. It's almost invisible to the naked eye at the moment, this dead skin at the roof. So you can see I just managed to peel that away. As I'm exiting the ear, I just want to see if there's any debris that I can remove from the ear whilst exiting with the sucker. And this view, the moment when I went into the ear, you may have seen just how narrow and slit the ear canal is, and that's another good view. So we really have to stretch the ear. So I'm just going to the roof and just peeling down. They've got this crusted skin just at the entrance. You can see this region of the ear canal is a bit more red and tender, it's a bit more inflamed. They have got some medication prescribed from their GP to help with this. The otitis externa, so this kind of psoriasis of the ear canal and eczema. So just got a bit of skin left. So I'm just working from the back first, just peeling it down and away. I always like going towards the centre with the suction probe. And you've got to be careful not to over peel, because what can then happen is you lose control of the tip of the sucker, and that sucker can, whilst you're in an attempt to peel this away, swing across to the other side of the ear canal and make contact, and that would be really uncomfortable. So you can see it's a lot of skin here. So I would say it's a complete total skin peel of the whole ear canal. So these are not procedures normally I would attempt with children, as I said, because it is always a bit more tricky, but this patient's been coming for so many years now, and they're so comfortable and they're so still, it's great. So it allows me then to kind of help them by removing all of this dead skin, which probably a few years ago I wouldn't be able to do with this patient. So it's just a bit, just past the first burn, it's hiding away, just going to peel that away. Just block the suction probe there. Again, I'm just stretching the ear canal wide open, then inserting the fine end, and then slowly just peeling it away. We're on the cartilage portion here, so we can apply a bit of pressure on the ear canal. The cartilage portion of the ear canal is less sensitive than the bony part of the ear canal, which is the inner 2/3. And that's because the cartilage portion contains a thick layer of skin, 10 times thicker than the skin that lines the bony part, so it's 1 millimeter in thickness. It contains some insulating fats, some muscles, and it's got 3 layers of skin. You've got the epidermis, the dermis, and the subcutaneous layer, whereas the skin that lines the inner part of the ear canal, it's just the outer top layer, the epidermis, the epithelial lining of skin. That's the patient's eardrum, nice and healthy. I hope you enjoyed watching that video, guys. Take care, speak soon, and do stay tuned. Thanks, bye.